Hello. When you perform thyroid US, you should include not only the thyroid gland but also nearby lymph nodes. Today, I will talk about the C-spine anatomy, which can be mistaken for lymph node metastasis. During the thyroid US, the performer usually pays attention to 3 to 4 centimeters of depth, including the thyroid gland. Let's see the lateral neck anatomy on US. When you place the US probe like this, the transverse process of the C-spine can be shown next to the main vessel. On US, this is the anterior tubercle, and this is the posterior tubercle. The anterior tubercle is more superficially located than the posterior tubercle. Therefore, the anterior tubercle is commonly mistaken for a calcified lymph node. When you perform US at the lateral neck, the anterior and posterior tubercles are connected like the crown or molar shape. You can see the brachial plexus, which passes by in between. This is the case of a 28-year-old female who had surgery for thyroid cancer 2 years ago. She had follow-up US at an outside clinic and was referred to our hospital to evaluate a calcified lesion at her lateral neck. This is the suspicious lesion shown outside the US. In transverse scan, it is connected to the C-spine body. This patient had a neck CT 2 years ago. When you compare the CT image with the US, the lesion can be confirmed as the anterior tubercle of the C-spine. On US, the most commonly mistaken part of the C-spine is the 6th anterior tubercle, because it is the most prominent. In this case, the right C6 anterior tubercle is more prominent than the left. In C5, you can also see the transverse process. You can see the brachial plexus between the anterior and posterior tubercles. On thyroid US, you can see the transverse process of C4 to 7 in the lateral neck. As I told you, the most prominent part on US is the anterior tubercle of C6. Posterior tubercles are placed deeper, which makes them hard to see on US. If you want to find the transverse processes during neck US, the easiest method is to find the anterior tubercle of C6 and move the probe slowly up and down. Because the anterior tubercle of C7 is rudimentary in many cases, it is hardly seen on US. At this level, the brachial plexus is seen anterior to the posterior tubercle of C7. Let's look at the other cases. A 60-year-old female had US at outside clinic. You can see the macrocalcification in the solid and hypoechoic nodule in the left thyroid. A lymph node metastasis was suspected at her left lateral neck. If you see the US, it is connected to the C-spine body, and the posterior tubercle is seen next to it. The anterior tubercle was mistaken for the calcified lymph node metastasis. A 69-year-old female was diagnosed with thyroid cancer at an outside clinic and referred to our hospital for surgery. In the outside US, a calcified lymph node metastasis was suspected at her lateral neck. Before you conclude this lesion is the anterior tubercle of the transverse process, you should consider the crown-shaped anterior and posterior tubercles connected to the C-spine body and the brachial plexus seen between those. On US, this lesion showed no connection with the C-spine and was confirmed as the calcified lymph node in the lower lateral neck. The transverse process was seen at the upper level of the lesion. At last, I will show you the transverse process from C7 to C4, continuously going upward. Thank you.